Hello, I'm Dr. Alka Flora Marak. I'm a medical specialist in Ganesh Das Hospital, Shillong. Today, I would like to take this time to speak to you a little about the timeline of coronavirus in our body from day 1 to day 10 and how it affects our survivability and how the disease progresses in our body. The past 1.5 years have been one of the most trying and difficult times with the advent of this new coronavirus, which has changed the course of our lives as we know it. This novel coronavirus and the disease it subsequently causes affects our body in many ways and forms. Its symptoms may vary from a mild sore throat, fever, body ache, cough, loss of taste and smell, generalized body ache, loose motions, to a more devastating and debilitating illness requiring oxygen and ventilatory support, the outcome of which may not always be favorable. So it is very imperative for us to understand the timeline of this disease in order for us to be able to manage the disease better and to minimize the suffering and possibly death. So we usually only think about the time the disease has taken a severe turn as the first day of illness. That is wrong. So day 1 of the viral infection is taken the first day as we notice the symptoms, however mild it may be. It may be a fever, it may be a cough, it may be a cold, or just a mild irritation at the back of your throat. So if you have this suspicion, count that as your first day of disease. So from this day on, the next 5 days constitute the first half of the biphasic nature of the disease. During this time, the first to 5 days, the virus enters the body and it lodges itself in a pharynx, that is the throat, and it becomes a part of the cell. And then it multiplies and multiplies and multiplies till there is a sufficient viral load. At the same time, since our body is not used to this virus, it will start producing antibodies against this virus to neutralize it or to kill it. Okay. So it becomes it is around at this time when the antibodies are fighting with the virus that we experience the symptoms like fever, cough, sore throat, and in 80% of the people of the population, the disease takes a mild course with its mild symptoms, and then it becomes better on its own with by taking some symptomatic treatment like maybe paracetamol, maybe a cough syrup, and they become better, and they recover normally. Okay. In the second phase, that is 5th to the 10th day, this is where the disease takes a more severe turn, and this constitutes only 10 to 20% of the people. So in this population, what happens is there are some very important danger signs which we need to notice, like fever, a new onset fever, a fever which was there before but subsided but has come back with a vengeance. It has crossed 100 degrees Fahrenheit and the fever is not subsiding with whatever antipyretics you take. And there's a chest congestion leading to a breathing difficulty. You're unable to breathe as normally before, and you feel like you're not taking in air sufficiently. And this third is a deep hacking cough, where no amount of cough syrup is able to help you with that. Then this happens. Why this happens is due to the onset of a cytokine storm. You know, the cytokines are chemicals which actually help the body in getting rid of these viruses. However, if these cytokines, which usually begins like a shower, in a small quantity, if this is allowed to progress to a storm, shower to a storm, then this is what will do more damage to your body than the virus itself. It's your own body, it's your own antibody which is attacking itself. So if this storm can be prevented, then the person goes on to recover well. However, if the cytokine storm happens, it leads the person to a more severe form of disease where the lungs are damaged, the different organs of the body are damaged. So at this time, we need medical intervention with medicines such as steroids and anticoagulants which help the body to fight against these chemicals which are causing harm to the body. And this can be done only under supervision of the hospital and doctors and the nurses, because these medicines, no doubt, they're very helpful, they're very, very useful in our body. However, if they are not taken under supervision, they can cause harm. So we definitely need experts to take care of these medicines. So you would have to get admitted in a hospital or take it under the supervision of a doctor, and this helps in prevent the disease taking a more ugly form, that is maybe ventilatory support and oxygen support. Okay, at the same time, around this time, since you're using steroids, since you're using medicines to lower the immunity of your body, bacterial infections can take place, other infections can attack you. So at this time we also need antibiotics. So we need to know the importance of the right time to start the medicines, the right amount to start the medicines, and the right duration, and the right patient on whom we use these medicines. This is not used for anyone and everyone who's suffering from COVID, but it is reserved for those people who are experiencing this severe form of disease. And all these measures can only be undertaken only if we understand the disease process to ensure favorable outcomes and minimal suffering, because that's what we want, minimal suffering and death. So the key messages I would like you to take from this small talk would be: if you have an early suspicion or a doubt of infection, kindly do not hesitate to go get yourselves tested. Consult your physician, and please remember the first day of your infection, however mild it may be, and recognize the danger signs as told before. Fever, which is not subsiding, a cough, which is causing you to lose breath, or a chest congestion, which is again causing you to lose breath. So we need to pay attention to these symptoms and look for danger signs. Over and above this, I would also like to emphasize on vaccination again. According to the statistics released by our Meghalaya government, about 97% of the people who lost their lives unfortunately to this disease were unvaccinated. It is not that you will not get the disease once you're vaccinated. You will get the disease, you may get the disease, you may not get the disease. But even if you get the disease, it will be of the milder form, which will be managed by symptomatic drugs, like maybe an anti-fever drug, maybe a cough syrup, and you'll be fine. However, if you are unvaccinated and you happen to catch the severe form of the disease, it will be very difficult for us to treat you. We will try, no doubt, but it will be very difficult for us to treat you at this stage. So I would really like to emphasize on this vaccination. Please vaccinate yourselves to save yourselves and your loved ones. Thank you.